Welcome back, everyone. Most patients of a hip replacement need a significant amount of time to recover, but some Valley doctors say that's all changing. And joining us now, Dr. Robert Berghoff from Arizona Orthopedic Associates and his patient, Jack White. Good morning, gentlemen. Thank you so much for being here. Jack, I want to start by setting the scene with your story. You had dramatic results.
Right.
Tell us, you were 2 weeks after having hip replacement surgery. You were training. Tell us all about this.
Well, I had about a 6-month lead into the process because by the time Dr. Berghoff operated on me, I think I was bone on bone or pretty close. And so I went through the process and then the normal rehab, which is about 2 weeks. But I started walking the next day.
And this video that we're looking at now?
That was, I was doing that in week 4, teaching that class in week 4. Essentially the same exercises with no pain. And no more constriction, muscles were really loose, feeling good, pretty much.
Doctor, tell us how this is possible.
Well, hip replacement's been around for quite a while. It's one of the most successful surgeries in all of medicine, the results as far as improvement in patients' function and quality of life. This is just a different way that we've been doing it, of putting the implants in. The surgical approach is a little different than the traditional approach. It's gaining popularity. It has several distinct advantages, and I think that's why one of the things we're seeing that's really impressive is the early results with the patients. They're just doing so well so quickly. And part of that has to do with this approach. We don't have to split the major buttock muscle, the gluteal muscle, when we go in, which is done in most other approaches. And we also don't detach any of the muscles from the femur, the proximal, the top of the thigh bone, which is also done with the other approaches. So that allows patients to have less pain, get moving more quickly. Lower risk of dislocating, which is when the ball can pop out of the socket, which is still one of the most common complications of hip replacement surgery, and that's a really big deal when it happens.
And just to give people some perspective, you were saying 300,000 people will need hip replacement surgery just in the course of a year?
In the United States, the numbers for hip and knee replacement are growing every year, and the predictions for the next decade or next couple decades is those numbers are going to go over 1 million joint replacements a year in the United States.
So how are you feeling today?
Wonderful, wonderful. I haven't had any pain since the 3rd week. I mean, other than the surgical site. In fact, the next morning, and Dr. Berghoff told me I was going to feel this way, the next morning I stood up and walked with my full weight on the left hip without a cane or a walker. And the pain I felt before surgery was gone immediately. It was just the surgical site, which you could expect.
It gave you a second lease on life, essentially.
Well, yeah. I mean, before hip replacement, I would have been a cripple, basically.
And psychologically, doctor, I'd imagine, you know, he's obviously in such great shape and a very active person. Psychologically, this can really do a number on you. I mean, if you can't get, you know, back out and do the activities that you always enjoyed. And
that's what leads people ultimately to make the decision to have a joint replacement is when the pain and the limitation of activity have impacted their lifestyle.
Yeah.
Just their daily activities and things they like to do. I had a patient recently who said to me, had lived with bad joints for many, many years, and after replacement said, I never realized how bad my pain was and how badly it affected my life until I didn't have it.
Yeah. Well, Jack, you look terrific.
Thank you.
I'm so glad to hear that you're feeling well. And doctor, we'll have the information for you on our hotline as well as on our website, azfamily.com. Gentlemen, thank you so much for being with us this morning. Appreciate it. Interesting
Thanks for having us.
information. And we're coming right back with a look at news and weather just in a moment.